Welcome back to the Lynne Hayes Freeland Show. My guest today, representing the Black Equity Coalition, Dr. Tiffany Gary-Webb, Dr. Jamil Bey, and this is the moment I feel like we've been waiting for at least the last couple months, but it's kind of, I think it's a good conversation for us to have because there's been a lot of mixed reaction, especially in our community. And then the media started focusing on the Black and Brown community in particular. And so let me start with you, Dr. Bey, because when we look at Black and Brown communities, all of a sudden the media started saying, or looking at our community saying, oh, there's some hesitance, there's some resistance. Why is that? What's going on? How's this going to work out? And what I'm finding is while there was some initial resistance, I feel like our community is coming around a lot faster than people are giving us credit for. Have you found that to be the case, or is that just me?
People are starting to say that. I've been saying all along, we trust the science. It's some of the scientists that concern us. And when we look at it, that the hesitancy narrative, the idea, it's been based on our experience in this country with public health, with the medical community. And so the media's attempt to turn it around, let's look at Black folks and understand why they don't hesitate, rather than let's say, what have you done, public health? What have you done, medical community, to cause these folks not to trust you? And so again, it's problematizing Black folks rather than looking at the history of Black folks as experiments.
And Dr. Gary-Webb, let me bring this over to you, because I think the other part of this discussion that I think sometimes I hate to use the term mainstream media, but I think that the media in general hasn't looked at is some of that history overlooks the fact that there were not people in public health, in the medical community, that looked like the three of us.
Yeah. And so I'm starting to see that narrative change a little bit. So you saw some of the clips with Dr. Fauci and talking about how an African-American woman at the NIH is one of the vaccine developers. There are also a couple of people of color that are working in the pharmaceutical companies on the vaccine. So I'm seeing a little bit of that narrative change, but it's true that, when we're thinking about science, you want to see, people you trust represented in the scientific community. So it's really important for us to have people of color doing research, being medical doctors, doing all the phases of this type of work, so that our communities can have more confidence in it.
And the realities are, we're not done with this yet. I mean, there are still groups that things we need to explore in terms of kids and expectant mother. I mean, there's still groups that we still have to explore. So this trip's not over yet.
No. So yeah, there's going to be a lot of studying that we're going to do over time. Another thing about it's not over yet. So just because we have the vaccine, we still have to practice our social distancing and wearing our masks. And even during this time, we're going to have to do those things if we really want to, in the end of the year or, sometime next year, be able to, do things a little bit more freely.
And that's an interesting point, Dr. Bey, because I think that before we started this show, I said to you, I think that the last time you and I talked, it was just before Thanksgiving, and we were talking about Thanksgiving travel and whether or not people were going to heed those words. Well, we see what happened. We are now kind of living still through that Thanksgiving surge. How do we convince people, and this is going to be a challenging question, but how do we convince people that we still have to be diligent? We still have to wear the mask. We still have to socially distance. We still have to wash our hands, because even with the vaccine playing out over the next couple of months, we still have to do all of those things.
I think two things that at least make me a little optimistic, and one is the unfortunate mess that we got into, the spike after Thanksgiving. Just nationwide, that it's all over the news. There's maybe not, they're exaggerating it. People see what happened when we didn't follow the rules around Thanksgiving. And, there's also Trump's distracted with something else. And so he's not downplaying the virus. He's distracted with his own noise. And so I think that a new administration and a new tone and a new sense of seriousness about getting through this so that businesses can reopen safely. I think that, I'm optimistic that some of that's going to resonate and more folks will follow the rules with this holiday season.
Mm-hmm. And then before we go to break, Dr. Gary-Webb, I mean, the one thing we've heard from President-elect Biden is, and Vice President-elect Harris is 100 days. Wear the mask for 100 days. That's what I'm asking. And yet I hear people say, well, we've been wearing the mask. It hasn't worked. But the realities are we haven't been wearing the masks.
Right. And it would have been a lot worse had we not been doing the measures that we have done. Right. Mm-hmm. So, I mean, I think that's what people need to realize is that we put something, we have a bad situation, but we put some things in place and that has made it less severe than it would have been. But I think, it's showing great leadership that the Biden office is now, they have a task force. It's a diverse task force where they're actually listening to the scientists and, the recommendations. I wish they hadn't said 100 days because we may need to go more than 100 days, but 100 days and then we can revisit it at the end of that period. But I'm happy to see leadership on that level. Mm-hmm. And, just the care and concern for the American people's lives.
We'll take a commercial break. We have a lot more to talk about this afternoon, depending on when you're watching us on the Lynne Hayes Freeland Show. We'll be right back. Don't go away.